How to perform a 7-site skinfold test. You will need your client to come in with shorts and preferably their shirt off or sports bra. You will also need large skinfold calipers. If you're right-handed, the way to hold it is that you hold it in your right hand and pinch down, then slowly release so that it can pinch the fat. Procedures. All measurements should be made on the right side of the body with the subject standing upright. Calipers should be placed directly on the skin surface 1 centimeter away from the thumb and finger, perpendicular to the skin fold and halfway between the crest and the base of the fold. Pinch should be maintained while reading the caliper. Wait 1 to 2 seconds, not longer, before reading the caliper. Take duplicate measurements at each site and retest if duplicate measurements are not within 1 to 2 millimeters, and rotate through measurement sites to allow time for skin to regain normal texture and thickness. The 7 skinfold sites are chest, mid-axillary, triceps, subscapular, abdomen, superiliac, and thigh. The chest measurement is going to be a diagonal fold, 1/2 the distance between the anterior axillary line and the nipple for men, or 1/3 of the distance between the anterior axillary line and nipple for women. The mid-axillary is a vertical fold on the mid-axillary line of the level of the xiphoid process of the sternum. An alternate method is a horizontal fold taken at the level of the xiphoid-sternal border in the mid-axillary line. The triceps are a vertical fold on the posterior midline of the upper arm, halfway between the acromion and acceleron processes, with the arm held freely to the side of the body. Subscapular is a diagonal fold at 45-degree angle, 1 to 2 centimeters below the inferior angle of the scapula. If you cannot see it, you can have your subject raise their arm and make sure that they relax it before you receive the measurement. The abdominal is a vertical fold 2 centimeters to the right side of the umbilicus. Did you get it? Superiliac is a diagonal fold in line with the natural angle of the iliac crest. You can have your subject point to the hip bone to get a better reference, and it should be taken in the anterior axillary line immediately superior to the iliac crest. The thigh is a vertical fold. Make sure that the right leg is rested and all the weight is on the left leg. The measurement is on the anterior midline of the thigh, midway between the proximal border of the patella and the nagual crease, or the hip. Before calculating, make sure that you have taken at least 2 measurements of each site and find the average millimeters for each site. To get your generalized skinfold equations for 7-site, men and women have these equations, which would find your body density. You would just plug in the sum of your 7 skinfolds and also your age to find out your body density. Conversion of body density to body composition. According to ACSM, percent body fat can be estimated once body density has been determined. 2 of the most common prediction equations are listed below and are used to estimate percent body fat from body density. They are derived from the 2-component model of body composition. So you would plug in your body density in either of these equations to obtain your body composition. And last but not least, once you have your percent body fat, you can plug the number into a chart just like this from ACSM to see which category you would fall under.